My talk has the title, Who's Afraid of Birth? And I will say something about the title in a moment. There's some reason for, it's not just a pun or something like that, but nonetheless, there's also, of course, sort of something about these elements. But I will start instead with a citation from a short story by Ingeborg Bachmann. I've been told in conversations with colleagues that Ingeborg Bachmann is not all that well known outside of German language countries, but one thing that sort of makes her famous apart from her own work is her relationship with Paul Celan, and their love letters are also quite an interesting read, one of the sort of least kitschy love letters that you can get as a book. But this is a short story where a father is describing the experience. I had no choice, needed to make no decision. I was moved because something was in preparation that was new and came from us, and because the world seemed to me to be waxing, like the moon before which one is supposed to bow 3 times when it is new and stands tender and breath-colored at the start of its course. Now I trembled at the very thought. I will get back to this a little bit. One of the things that's important to me in here is sort of is this relationship to the new and the trembling. So there is something here about the sort of connection between wonder and anxiety that is of interest to me. But I will now get to my actual title, the Who's Afraid of Birth thing. So the who component of that question, I believe, is actually quite important. And instead of clearing that up, I'll initially make it more complex. So you could ask with Martin Heidegger, and he does so at certain points in Being and Time, who is the who of Dasein? And if you then want to get Dasein out of that sentence as something that might not be familiar to everybody, well, since Dasein is who we are, you end up basically asking who is the who of who we are? And the question to this the answer to this strange question with Heidegger would be, it's the they self. Now that points to a huge can of worms that I'm not really going to open here, and I will not really be talking about this tricky concept of inauthenticity. But when it comes, I mean, the reason why Heidegger says that we are a lot of times mistaken thinking about who's the who is that we don't really take into account that normally we a lot of times follow what they say. So this sort of strange expression they self on the most sort of superficial level designates what we usually assume to be the case, or what they say or what they think. And then one very rough and roundabout question, I seem to see starting with the questions just makes me constantly talking about questions, which Heidegger says is what philosophy is all about. But to say something a bit more affirmative first, is that if you wanted to introduce phenomenology in a sort of rough and roundabout way, then you could say that phenomenology is a philosophical approach that takes its departure from these kinds of everyday conceptions about what they say something is, and instead tries to uncover something like a deeper dimension. And this deeper dimension is also sometimes by phenomenology described as focusing on how rather than what. So the assumption being that usually in everyday life we are just quite absorbed in all sorts of what's at stake. So as an example, take the question, how does a human being exist? And then yet again a bit of a rough and roundabout existentialist answer would be to say, well, we exist as subject as well as object, and one feature of our existence is that we fail to resolve this tension, so we cannot really bring those two together very comfortably. We usually experience ourselves either as subject or as object, yet at the same time we know that we are both, and so this kind of tension is uncomfortable. And Simone de Beauvoir calls this very tension the ambiguity of our existence. So that ultimately being a body And one of the emphases of phenomenology is also to point out that it's not quite right to say that we have a body, because the body is way too intricately connected with us to consider it as a kind of possession of some sorts, but rather what we are is to be a body. And being a body, in the end, means being this really rather strange thing, namely an object in the world, exposed to the environing world in all sorts of ways, and at the same time a subject who gives meaning to that world. And in crucial life situations, both of them come to matter, and birth is one of those. So I'll get back to this subject-object issue later on, but I will now first attend to the other parts of the question and ask, what are we actually afraid of when we are afraid of birth? And there, the phenomenological inclination would be to say, well, let's see whether what we usually assume to be the cause of the fear is actually the cause, or whether perhaps it could be a little bit different. So the usual perception, which Heidegger would also sometimes call the vulgar perception, but that is not usually translated like that into English, but I think it's quite a good graphic expression. The usual perception would be that the fear is about the pain. And although that is certainly not wrong as such, it's not really quite, I think, what one would arrive at if one tried to dig through to a deeper level. But one reason why there is something problematic about this usual perception is that then there is also a usual response to that, and that response would initially normally be a medical response. So the medical possibility that is designed to deal with that fear is this thing called epidural, and that's an invasive measuring. That's an invasive medical procedure, and lots of women don't want it because, or lots of birth-giving creatures don't want it because it's the kind of thing that can also have bad consequences on the process. But then one is already, again, put in a strange dilemma situation where one then sort of, if one rejects that response, then one doesn't really have many alternative responses. One doesn't really have medical alternative responses. So that's the point, I think, when people a lot of times turn to the kind of thing that I would actually even call ideological responses of some sorts, which is not from the outset meant to sort of put them down, but they just a lot of times don't really fit, I think, for the individual. Acupuncture, I'm sure, can be excellent for some people, but not necessarily perhaps for everybody. And I think it's sort of a strange function that when confronted with this kind of difficult situation, and also not really being able to think through all the aspects of what this experience will actually mean, it gets quite difficult to try and think about possible responses outside of the medical realm. And again, the medical realm also doesn't really have to offer any variety of things, but just basically one thing. So, as an alternative, there would then be the phenomenological response to this question: what are we actually afraid of when we are afraid of birth? And the phenomenological perception would be to say, well, it's difficult to describe. It's sort of, there are certainly some affinities here perhaps that we have with this fear and anxiety distinction that Susanne was talking about. But we could start by saying, well, it has certainly this really strong dimension of the unknown, leading even into something like the uncanny. And if one then tries to tease that out a little bit more closely, then one has unknown factors, certainly also on a very mundane level, that are involved with birth. So all the crucial questions like when and how and with whom are questions where it sort of initially seems that one can answer them, and one is sort of given a certain illusion that one can make all sorts of decisions about them. But in the end, ultimately, because the when is so unknowable, there are also then contingencies about the how and where and with whom, since not all those other bodies might be in the right places at the right times. And so that also contributes to the fears in certain ways. But ultimately, those are indeed rather mundane unknowns. I mean, one can sort of deal with them in a number of ways. But there is also a deeper existential dimension of the unknowns, and that is the kind of dimension that, that one can perhaps phrase in the question more along the lines of, how on earth will this be possible? And what I mean by that is that our concept of our body is basically such that it excludes the idea really of having another body in me, but even more so, it excludes the idea of a body leaving my body with both bodies being intact. That is ultimately rather inconceivable, and in that sense it's paradoxical. I mean, it's not paradoxical in the sense of formal logic, but it's more sort of paradoxical in the etymological sense of paradoxical, which would mean to be against doxa, to be against opinion or belief. In other words, I cannot really believe that this will indeed be possible. And then there's at the same time the strange clash that even though it is impossible in the sense of being inconceivable, it at the same time happens all over the world all the time. So there's a really strong clash of the knowing it to be utterly possible and at the same time not being able to imagine that it will be possible for my conception of what my body is. And that is perhaps in a certain way also kind of a bit of a parallel to the way in which Heidegger describes death by saying that, well, we know that others die, but that I would die is nonetheless something that is quite difficult to incorporate into one's idea of existence. But this inconceivable nature of giving birth is then also something that brings us from face to face with what it even means to have a body sort of in general. So it just makes me more aware that the only existence that I have is this existence as being embodied in that one body. And other phenomenologists, such as Husserl, also sometimes talk about the fact that the body is something, Husserl calls it a strangely imperfectly constituted thing. So it's on the one hand much less accessible to me than other objects, but also it's a constant here, it's constantly with me. I cannot get out of it and detach myself from it. And that is also something that becomes quite pressing in that kind of situation. So what one ends up with then is ultimately a mixture of mundane and existential unknowns. And the deeper existential unknowns is what one could perhaps indeed treat under the heading of the uncanny. And it seems to me that it's indeed this mixture that makes the situation very volatile, very precarious, very fragile, because it's indeed the sort of difficulty of dealing with those mundane important factors of the situation, while at the same time having an inkling of this deeper existential dimension, and again also having an inkling of the way in which birth is one of those things that brings us face to face with the strange character of existence overall, where of course the other end of that strangeness will be treated by Harvey's and Paul's papers on death. So if the phenomenological perception is to be roughly right, then the important question ultimately is there a way in which we can respond to that? Could there be an alternative response that would not be the usual medical response? Well, it's much more difficult to say something about that, but I want to at least outline 2 steps as to how one could think in the direction of such a response. So the first idea would be that it would appear worthwhile to start understanding the emotional landscape that is involved with this particular life event more fully. And because a lot of times, a lot of times fear would indeed be conceived as something that one has to, in some sense, cope with. And in fact, by using the term cope in the description of the event, it was not really intended to think that this is a sort of normative claim of what we are dealing with this afternoon, that somehow fear is just something that the individual should just learn to cope with, but rather that this sort of assumption that the individual has to just cope with it is exactly the kind of thing that makes it quite difficult to open it up for a fuller investigation and discussion, because it's usually conceived to be something rather private. So to make it something that would indeed be investigated and discussed could bring interesting results. And there would be other moods, other emotions involved in this emotional landscape as well. I will not really go into that much here for now, because I'm in a sense sort of sketching these steps. But one sort of observation that is also being discussed in the psychological literature is that in addition to sort of something general like fear or anxiety, there is, for example, something that one could treat under the heading of anticipatory anxiousness. This is also something that Heidegger would be sort of quite comfortable outlining in a certain way. It has to do with this sort of coming closer and so on. And the interesting thing about anticipatory anxiousness, but what this is meant to designate is the kind of anxiousness that occurs before birth actually starts happening, before even the first signs of birth start occurring. And the interesting thing about that is that psychological research shows that, that a higher level of this anticipatory anxiousness actually corresponds normally to a better birth experience. And that would perhaps indeed be because of the kind of thing that one might want to call reflective coping, but I will need to listen to Harvey's paper later on to see whether reflective coping is something that can be used as a title to cover this kind of thing. But the emphasis for me there would be more on the reflection than on the coping. In other words, that reflection, and in that sense sort of preparing oneself, can actually help in certain ways. And that would also mean that despite the fact that it's ultimately indeed inconceivable what it will really mean for a body to give birth to another body, it is nonetheless important to try and imagine. So it's the sort of despite factor that is actually quite relevant. And that would also be something, this kind of reflection would help to make decisions about the other mundane unknowns and see how one can respond to those in the best fashion, while also taking into consideration that there is not going to ever be complete control about any of these unknowns. Now, another aspect of this emotional landscape would be something that one could cover under the heading of wonder, and that is, of course, indeed, in principle, something that would be a very good sort of balancing pole for the fearful aspects of birth, because there is something quite wondrous to be expected there on the horizon. And with that kind of thing, I mean, it doesn't, wonder there isn't meant to say that the outcome is going to be necessarily great in terms of there is just going to be wonder at the emerging creature necessarily, but more like the newness as such, this sort of radical newness and indeed a new life would be the kind of thing that would inevitably have some aspect of wonder. And at the same time, that kind of wonder would not really be as sort of opposed to the uncanny as it's often presumed. And again, that is one of the things that I quite like in this quote from Bachmann, that on the one hand, there is this sort of being in awe as if looking at the moon, and on the other hand, there is this trembling that goes along with that. So ultimately, all those emotions are quite closely connected. So that would be one aspect. And then the second step of the response would be to take a phenomenological approach and look at the way in which emotions are very closely linked in with a situation. So Heidegger presents the phenomenological approach to emotions as in contrast to the psychological approach as something that takes into consideration that moods come neither from within nor from without, but arise out of what he calls being in the world. So, in other words, arise out of this interplay between within and without. And if one wanted to think about this being in the world in relation to the here and now, then one would end up with the concept of the situation, I think, which is also something that plays an important role in being in time, but in a different place that is irrelevant for us now. But if one wanted to look at this particular situation, namely the birth situation, then there is actually something quite peculiar there when you think about the others, the sort of the Mitsein, the being with others that you get in that situation, because you get a very strange mixture of people for the most part who would be present there. You would usually have somebody like your partners or somebody who is very close to you, somebody, you know, I mean, there can of course be variations as to whether it doesn't obviously have to be your husband or something like that, but it would in any case normally be somebody you know very well. And then at the same time, there are complete strangers there usually, namely the health professionals who are helping with that situation, midwives and obstetricians. And you have both of those things together, so you have a pretty volatile crossover. So yet again, you have a sort of strange mixture that adds to the volatility of the situation. And both of those aspects are actually quite difficult and I think sort of worth looking into more closely. Because it's not as simple as sort of thinking that the presence of a loved one would necessarily be just sort of under all circumstances be helpful in that situation, but rather it can, in a sense, even create additional strains. And that could sort of, on the one hand, come about because one might also be uncomfortable undergoing such an experience while being in the presence of somebody one is so close to, in a sense being witnessed by that person, also being witnessed by that person in terms of losing control. And then if one looks at the whole spectrum, actually even more generally speaking, from pregnancy to being with a newly born, then the strain becomes, in a sense, even bigger, because, I mean, the newly born is effectively an alien in a sense that one could spell out more closely, not by way of shape or so, of course, but by way of what Husserl calls inaccessibility, that we can't really communicate. And that is not just verbal communication, but initially there isn't even really communication very much by way of glances or gazes or so. But that would be something that one would need to actually look into separately. But I mean, we know nowadays that having a baby is one of the main reasons for separation and divorce, but we don't particularly know very well as to why that is the case. And it could be that not really understanding these uncanny processes very well could have something to do with the reason for that. And the other difficulty could be that we are mostly unable to communicate and to speak about these bodily experiences and also about the emotions involved in them. We don't have particularly good words for doing so. That's where, again, literature can come in, I think, as helpful. And we also find it uncomfortable to do so, and it's just something that is not particularly easy to do with a loved one. But I think there's sort of the common perception that basically the only thing that is there to deal with is something that comes under the heading of pain also doesn't help. You know, that is also something that gets in the way of a more successful communication about it. But the other difficulty is the communication with the health professionals. And that is something that is in general, I think, a big problem when we deal with health professionals, that in a sense there is always a kind of fear that they treat us too much like an object, that they focus on our body, and that's indeed what they are specialists for and what they are supposed to be doing. But our body for us is not just something that can be put on the table, but it's really who we are. And so this can basically only work if they really also take us seriously as a subject who is that body. And so in that sense, you know, one could try to come up with a very general kind of guideline that we hope for health professionals to treat us like subjects and not like mere objects. But it's actually also more complicated than that. And there's sort of one brief example from my own experience that I would like to give to explain why it is more complicated than just saying we want to be treated like subjects. My own sort of most recent birth experience was about 2 years ago here in England, and it was a home birth. And it was basically all going quite well. There was sort of one communication thing that made me uncomfortable because I felt treated like an object. That was the fact that the midwives who came to attend this birth were whispering to each other for a very long time, and that somehow made me feel quite uncomfortable because I indeed felt like I was just somehow an object in the room, and it was also not being considered that whispering is the kind of thing that can just somehow make you particularly ticked off, because you cannot help but trying to understand, then reminding yourself that really you don't want to try and understand, and so just sort of get into that kind of circle. But then, on the other hand, they were also trying very much to treat me as a subject and asked me every 3-4 minutes, how are you doing? And initially, I indeed took that to be the caring question that on some level, of course, it was meant to be. But the process takes a long time, and you don't really want to, to be asked every few minutes and have to formulate a response in words can actually be indeed quite difficult, because I was, in a sense, in a kind of bodily realm where I didn't really want to have to bring words into the situation, and I didn't really want to have to think about what answer do I now give to these two strangers that describes my inner life very well. So, in other words, even though I'm in general saying that it would be helpful to learn to communicate better about the situation, it is in the situation actually not a very good idea to rely on verbal communication. And so the sort of treating the other like a subject also becomes more difficult, which is where Heidegger comes in with a suggestion that I thought would be worth noting. So Heidegger has a few interesting things to say on discourse, so in a sense on communication. Firstly, he points out that, quote, hearing and keeping silent are possibilities belonging to discoursing speech, unquote. So that part of what he's trying to point out there is that silence is not really a lack of speech, but is actually a very important dimension of discourse, and listening to the other and listening to the situation also involves the need to not be afraid of silence. But at the same time, I'm not trying to say that being silent is the response, but being silent and perhaps considering more the level of intercorporeality, which is itself something that one would have to explain more fully if one had more time, can be perhaps a way of starting to deal with the situation. And Heidegger also says that if such discourse in the wider sense is successful, then it, quote, brings about the sharing of being attuned together and of the understanding of being with, unquote. Which I think is, on the one hand, always nice to hear Heidegger say such things, because it sometimes seems that he doesn't say them much. But I think it's also indeed quite a nice sort of reminder that there can indeed be this kind of just being there, being with the other, that would evoke a kind of sharing. So what I'm trying to say as far as this communication with the healthcare professionals is concerned is that they would certainly, I think, benefit from taking our perspective, but at the same time, I'm also aware that we would also really benefit from attending more to their perspective, because I'm also aware that part of the reason why it's very difficult for them is that their situation and their working conditions are very, very stressful. And so in that sense, I think it could also be a responsibility of society to think, well, this is a really, really crucial profession, and letting them work in something like 8-hour shifts or so is not going to be a good response to improving the situation. So, in conclusion, who is the who? Well, who is the who is ultimately always somehow the subject. One important difficulty of the birth situation in particular is that if the subject in the situation gets so discouraged that she just wants to leave the situation, then the situation is quite likely to deteriorate. And at the same time, the process involves so much fragility and waiting and unpredictability and dependence on others and confrontation with emotions that the who can easily get crushed. But if there is no longer a who in the situation, then it becomes impossible to summon this who back in the crucial moments, and as a result, medical interventions become much more likely. So this creates, in the end, difficulties for everybody, especially for the who, but also for their relationship to the to whom, as well as to the relationship to the with whom. And for all of those reasons, it would seem worthy to reflect on it. And that's the end.
Just about something which you didn't mention about the things that you're afraid of in birth, that looks as if it bridges the two things that you did mention, the medical and the phenomenological. And perhaps it's less present now than it would have been 150 years or whatever ago. But that's death. It looks like that certainly would have been a very likely fear a while ago. And I don't know how much it's a fear now in people giving birth, but I don't know if it's in the background, but it seems to me that there would certainly once have been a very strong fear of death, both for the mother herself and of course an anxiety about whether the child would also or instead die. And that of course in a way that brings in both the medical and the existential in very obvious ways.
Yeah, thank you. No, that was certainly also something that I was thinking about at some point when thinking about sort of how fear and anxiety relates to this. And of course, if it was indeed death that we are ultimately fearful of, that we are fearful of on the level of anxiety when it comes to birth, then the Heideggerian setup would work even better ultimately. At the time, it seemed to me not true anymore nowadays, just sort of statistically speaking, because statistically speaking, it's nowadays extremely unlikely, especially for the woman, to die during birth. But at the same time, my attempt to describe how as a body we just can't really imagine ourselves getting out of that experience sort of in still one full intact body is in a sense just perhaps another version of that, because even though statistically I know that it's very unlikely, it's sort of on the level of perception seems not that unlikely, It seems sort of not that unlikely that a body could get broken somehow in this process.
I know that in some sense one's not meant to think about pregnancy and birth as like sickness, but I was sort of struck by your thought that part of the existential dimension is the inconceivability of something leaving you and it being intact and your body being intact. And indeed, inconceivable that there's another body inside you. And perhaps this is just me, but I find it kind of inconceivable that I have guts and all that kind of length of intestine can fit in the whole inside. It's as if there's not enough space. And then when that goes wrong in sickness, I don't know, perhaps there's not the same fear, but I was wondering if there's a related anxiety in just, we don't really conceive of our bodies as having an inside, I think, at all. And I don't know whether there's a relation there. But,
No, I think there certainly is, and I'm also looking forward to Harvey's talk in that relation. I recently read a very interesting essay by Jean-Luc Nancy called The Intruder, in which he reflects on his heart transplant sort of 10 years later. And part of that process of living with a heart transplant was also for him to get quite seriously ill from the medication he was then given so that the immune system would deal with that transplant. And yeah, he describes this sort of this really strong alienation that comes about when you can no longer take your body for granted, and when you suddenly sort of have to engage with the fact that you know that there's a heart and a bowel and what's not in there, but you can't experience it. It's invisible, and then I mean there's one very nice sentence where he says that it would just be impossible to disentangle the symbolic and the literal and the biological and the medical in all that. That all gets sort of mixed up for us, and that's why sort of alienation, I think the sort of the sense of the strange, of the alien, of the uncanny would for me be the kind of thing that would connect those experiences. Mm-hmm.
I wasn't quite sure whether what you were saying about the usual situation, the usual perception. So what I'm going to say maybe neither here nor there to what you said, but I have always remembered an ex-colleague of mine who, when she went to give birth, just went straight up to the whoever it was who was going to perform the operation and said, "I don't want to know about pain, and I don't care about natural." There was a sense there where, and that might be a kind of common view actually, that is a little bit like when you're ill and you go for an operation, where you feel that moment of relinquishing your control and subjectivity, and just like just almost throw yourself upon the trust of the medical procedure, and I think that's that's a kind of a way of. I mean, I'm sure there's more cooperative and more spontaneous and active ways of thinking about birth and partnerships and things like that. But I would be surprised if quite a few people didn't cope precisely through that kind of mechanism of self-objectification or something like that. So that's all I was really going to say.
Yeah, no, it is quite common, more common in some countries than in others. I think in the United States it's more common. I mean, from the medical side, there is an attempt to not allow for this kind of option, or to not just do it simply on the grounds that that would be the easiest, or would appear to be the easiest way of dealing with the situation. So the medical profession would like there to be additional medical reasons, and at the same time, we then a lot of times hear that celebrities, for example, nonetheless have recourse to this option quite fine. So money seems to ultimately also play a role in terms of going for it. Yeah, I mean, it's sort of, I'm wondering on what grounds I am arguing against it, because I don't want to just dismiss it on the basis of a prejudice. I mean, you miss out on a very rich emotional landscape, but it's also a very terrifying emotional landscape. So I think in retrospect, it's quite nice to have seen the whole range that is involved. But at the same time, I mean, then you also get, I guess, into situations like, what if a cesarean in the end becomes necessary anyway? Would it then not perhaps have been a better decision to have said, well, then just from the beginning and not even go through the anxieties and so on and so forth, which is why I think there is then indeed this drive to say, yeah, but only if there are medical indicators that indeed this could be the outcome and there's a high likelihood for that, and so therefore perhaps propose the step from the beginning. I think it also perhaps has indeed something to do with how one feels about oneself and how comfortable one is to hand oneself over to the medical profession. I think I have always had major difficulties with that, and other people perhaps don't. So.
If I'm not wrong, but I may well be, that there was a kind of feeling that, say, natural births and home births involve slightly more risks, whereas the hospital treatment of the kind of the most objectifying procedures involve less risk, and hospitals slightly pressurize or incline patients towards yielding up to the medical procedures, epidural and all. And is that not?
Well, this country has been really excellent at developing detailed statistics to show that home birth is not more dangerous, but can be if it's your first time. So in other words, for the first, if it's somebody who's giving birth for the first time, then there's it's ever so slightly higher risk that something would go wrong in terms of the baby, and there's a very high risk of transfer to the hospital. So that is one thing to consider. I think about a third of all women who give birth for the first time and try to do so at home actually have to be transferred to hospital. And a third, of course, is very high. So in that sense, if one is sort of imagining that scenario, then one has to also already imagine the transfer into it, and the transfer can, of course, also be a very unsettling experience itself. But apart from that, for so-called multifarious women, it's actually as safe to give birth at home, and not surprisingly, medical interventions are less likely. But I mean, that is one of those things where statistics ultimately doesn't really help you much, you know. I mean, it's just so obvious, you don't even need to count. It's just very obvious that medical interventions in the home are less likely. But what this means is also that in the case of having already given birth, then there's actually the likelihood of transfer to the hospital and still needing medical procedures there is less high for the person who decides for this than for somebody who is in the hospital to start with.
I have one question. I don't know whether I understood you correctly. You said we don't have a body, we are a body. So this is like the phenomenological approach to thinking about these things. But when you list the features of the process, we are involved in fragility, waiting, unpredictability, and so on, dependency on others. I also miss the feature of being a body very much in that situation. I don't know, well, maybe illness, but giving birth is a very existential body experience that we don't have normally. So isn't that also something which is uncanny, or which actually causes or can raise some fear?
Yeah, certainly, and along with that also the sort of misplaced desire to want to be able to just leave this body for a little while and just sort of take a little bit of rest, and not being able to. But yeah, it's certainly very much a close confrontation with what it means to be a body, and indeed not being able to experience it as having, as a possession, yeah. Including also all sorts of sort of shame factors that can go along with that, but that would be yet a different topic.
Thank you very much. I guess I was wondering, obviously you're focusing on the fear, the question of who's afraid, but the expression of giving birth, it seems to, no one sort of pulled out the idea of the gift that's involved here, which I think sort of fits problematically and interestingly with this tension of subject and object in the process of birth itself. And I wondered I'm sure you've already thought about this and looked at it, and I wondered if you could say a bit more about that.
Can you phrase it a little bit more as a question? Sorry.
Yeah. So I suppose the idea of the gift, in some sense, sort of the most spectacular sense of the event of birth is the creation or the bringing forth of another. And something about the radicality of that seems to interestingly relate to the way in which we talk of giving birth and this vocabulary of the gift. So, you know, the gift of life and all of this, and I suppose I'm interested in how, if at all, that would fit in with perhaps our desires to experience the whole experience. To know what it is to have given such a gift, which is in many senses incomparable with other gifts. And I wondered what you thought about that.
Mm-hmm. Yeah, okay, thanks, yes. Yeah, I mean, one interesting aspect is that in certain other languages you don't describe it in that way. So in German you don't give birth, for example. But if you indeed, I mean, nonetheless, the sort of phenomenological description of a kind of gift-giving would still apply, I believe, if one thinks through it. Of course, one could think about the gift of giving life to this other, and then it would indeed, I mean, you know, with people like, for example, Derrida, there's always this emphasis on the gift as something that is not about reciprocity and has this sort of radical, this emphatic kind of giving. And that, I think, would be the case with birth as well, already in the sense that there is also indeed no choosing. So it's this kind of gift that is just kind of unloaded on the child, so to speak. So here you are, you know. So then you get into this existentialist situation of existence precedes essence, and you are condemned to be free and all that. So in that sense, it's an ambivalent gift, you know. But there's also one interesting aspect in which it actually indeed has a sort of gift character for the birth-giving party, because not only do you then get this alien handed to you, but you also get your body back. I mean, you get your sort of, to speak with Merleau-Ponty, you get your habitual body, you get your habit body back that you basically were deprived of for the last few months of pregnancy. And that is also something that is a sort of nice reward, as it were. Okay, good time for coffee.